all blast injuries are accompanied with chronic pain, and it severely impacts their jobs, their mind, and their families. Ukraine should be the global leader of medical innovation in case of research with military trauma. We're doing joint research with the United States. It's about using Stellate Ganglion Block plus ketamine. There's so much severe injuries, so much unique data, and so much unique opportunities to do innovation that shouldn't be, it's a necessity. My name is Smolynets. I'm head of pain management center in First Humanitarian Union and in Unbroken. Innovation are created on the places like this, where there are severe existential threat on you. My main motivation will be to help military people who suffer from the pain to create the sustainable pain management center in ecosystem of Unbroken. The main data is here, and the main research is also here. We established the research center to be the cumulative for all of this data and research, which we'll produce for the globe. We know the effect of ketamine, about how it works on central sensitization as a blockage of NMDA receptors. We know how it works the stellate ganglion block, decrease the hyperarousal of the amygdala and block the sympathetic chain. But combining them together could be really high-level innovation which will change people's lives. And if we will change this by its clinical trial, clinical research, we will change the whole spectrum of how we manage globally this problem, and it could help millions. That's why I'm so grateful for Department of War, for Aspen Group, for Terrauch, Palpas Stephen Cohen, Univern University, Fort Bragg, Walter Reed, Northwestern. Thank you so much.